Hello, and thank you for joining us today for the third webinar in our year-long COVID Commons webinar series, Taking Back Control During COVID-19. I'm Nate Wade, your host for today. As Senior Director of Strategic Initiatives at ASU's College of Health Solutions, I co-lead our college's COVID-19 Diagnostics Commons initiative with Mara Aspinall, who will be moderating today's event. Mara is a professor of practice at ASU's College of Health Solutions and a diagnostics industry expert who helped found our master's degree in biomedical diagnostics. Mara and I would first like to recognize and thank the Rockefeller Foundation for their generous support of our COVID Commons initiatives. We would also like to thank Deborah Hellitzer, Dean of the College of Health Solutions, for her ongoing support. Like our speakers today, Dean Hellitzer is an innovative leader who is working to reimagine health and create a better future. Before introducing our panelists, a few housekeeping items. First, this session is being recorded and it will be posted on our website, asucovidcommons.com. Next, we will have a discussion and Q&A session during the last half of the webinar. Please submit your questions using the Q&A feature and not the chat feature. We value your feedback and plan to send a brief survey asking for your input about today's webinar and ideas for future event topics. Finally, we encourage you to get involved in our COVID Commons community. After the webinar, please visit asucovidcommons.com and sign up to receive invitations to future webinars, visit Testing Commons and Workplace Commons, view our T3 Testing Technology Trends blog, or provide an employer case study. Now that housekeeping is behind us, I'll turn it over to Mara, who will introduce our speakers. Mara?
Thank you, Nate, and good morning, everyone, and welcome again to today's webinar, Leading Innovation Through Uncertain Times. We have with us two strong and impressive leaders who are known for innovation, for collaboration, and for how they have led their teams to action during this pandemic. Michael Crow and Raj Shah are leaders who have designed solutions to optimize the health and well-being of the communities that they serve locally and around the world. It's easy to say, but really hard to do. Now is the time for strong and clear leadership. 9 months ago, almost to the day, states began to shut down. And while it is so exciting this week to see the vaccine rolling out, we are not close to the end of dealing with COVID-19 and its aftermath. One of the sectors most profoundly impacted by closures has been our educational system. So many universities were closed and then open with restrictions and then closed again. The K-12 system has been decimated, with less than half of our nation's kids able to learn in person. While so many educators have risen to these challenges, we need to make it easier and safe for them to return to the classroom. Today's conversation has two of the world's leading experts on these issues. Through Dr. Crow's leadership, ASU has not only remained open for students, it has remained open and active for all citizens of Arizona with statewide testing. Dr. Shah has led the Rockefeller Foundation's focus to articulate a national plan for COVID testing, working with scientists and policymakers across the country. And today is perfect timing. ASU just completed its fall graduation, and just a few hours ago, the Rockefeller Foundation released its third national report on COVID testing, Taking Back Control, a resetting of America's response to COVID-19. This report focuses on the critical need for reopening our K-12 schools with specific and highly actionable recommendations on how to do so in the next 60 days. So now let me formally introduce them. Dr. Michael Crow is president of ASU, the largest university in the country. Michael recognized early on that COVID-19 was not going away anytime soon, and moved quickly to implement strategies to keep the university not just open, but thriving and advancing on all measures. Through Dr. Crow's leadership, ASU created one of the first saliva-based COVID tests and implemented a comprehensive protocol that has allowed 100,000 plus ASU students to continue their learning without any interruption. Under his leadership, I'm so proud of this, ASU has been named the most innovative university for 6 straight years by US News and World Report. Dr. Raj Shah is the president of the Rockefeller Foundation, an organization dedicated to new frontiers of data, science, and innovation. It's there to solve global challenges related to health, to food, power, and economic mobility. Dr. Shah has convened partnerships to accelerate the global response to this pandemic with strategies for addressing inequalities and safely opening up our economy. As a science-driven philanthropy, the foundation recently announced that it will allocate $1 billion over the next 3 years to address the pandemic and its aftermath. I'm sure this is going to be an interesting and active conversation. First, we'll hear from Dr. Crow, then Dr. Shah, and then we'll have time for dialogue and questions. Over to you, Michael.
Yeah, thank you, Mara. And it's great to be here with you, Raj, and have a chance to talk about this really important topic. I think for us, what I'd like to talk to the participants about is really the notion of education, K-12 and universities thinking of themselves as essential. We're not as immediate as a hospital or as a clinic, but we're in the same category of essential. And what we mean by essential, what we do, the training and educating and developing and socially engaging of our young people is unbelievably essential to the success of all aspects of our society. And so for that reason, we decided immediately, we stood up our emergency response team in December with the first cases that we heard about in China. We knew from our H1N1 experience, from the MERS and SARS experience, we knew that there was some possibility here. And so we had our first case, actually a person in our community from China in January. And then by this day, as you said, in March, we were a part of the wave of moving forward, but we decided that we would never close, never shut down, never miss 1 minute of the essential services that we had to offer, but that we might have to operate in many, many different kinds of ways, which is what we've done. And so a key thing driving us, and I think this is important for people to understand, is what we call our ASU charter. There's 3 elements to the charter: an institution built on inclusion versus exclusion and measured success of our students. Second, doing research that immediately and measurably benefits the public, not just the stock of knowledge from academia. And third, taking responsibility for the outcomes of the health and well-being and success of our communities that we serve. So then that means then the institution, and I don't mean this in a sarcastic or nasty way, we don't exist for the faculty. We exist for the community. The faculty are the means by which we deliver the services and the programs and the so forth that we need to deliver. And so our charter and our design said to us that we need to figure out what to do, and we needed to figure out what to do rapidly. So we began doing everything we possibly could. We built a health check app. We now have tens of thousands of people every day, students and staff. And Raj, this might be something you guys might want to take a look at, where you're doing symptomologies, which are guiding you to either staying home or getting tested. We built our own, as Mara said, high-speed testing technology, PCR-based, deadly accurate. We can count the number of virons, the viron load in individual people, giving us a lot of data, a lot of insights. We've tested hundreds of thousands of people. We've made testing ubiquitous on campus, random testing. We've also then opened the testing to the community. We then also created a technological capability. We built technology in over 1,000 classrooms to zoom in or zoom out any person. So for any reason, if you didn't feel right about being on campus, needed to stay home, whatever, you could do that. I won't walk through all the things that we did, but then we also began accelerating our teaching and learning modalities. We have been engaged now for some time in now taking all of our assets and moving them to every K-12 institution that we can partner with. We call ASU for You. Learning assets, teaching technologies, teaching methodologies, adaptive learning systems, testing systems, health check systems, anything that we have that we can make available. We've been able to do that. And then, I think most importantly, what we've also done, and I think Rockefeller is doing this, is that we don't see this as a short haul problem. We don't see COVID-19 as a storm. We see it as an early indicator of climate change. In fact, I don't mean climate change in the broader sense of climate change, but it's a climate adjustment, not just a storm. It is related to climate change. And so we look at this as a long-term thing. We've had a record enrollment. We graduated 10,000 students in our fall graduation just Monday of this week. We have been reaching out to high schools, K-12 communities, teachers individually, families, parochial schools, homeschool parents. And we believe also, and Raj, you guys are doing this at Rockefeller, that it's by central groups like Rockefeller coming together and then networking and knitting people together. Our K-12 enterprise and our academic enterprise in general is too much of a cottage industry with each little group trying to make its own little decisions and so forth and so on. I will say in my final comment, we've also, we had 12,000 students living with us on campus. We have been dealing with COVID content. What we found using the Wall Street Journal's phraseology, this will be my last point, of the Swiss cheese model. So daily testing, masking, health checks, distancing, and then now ultimately the vaccine are all incomplete by themselves. They all have holes. There's ways for the virus to be still moving around even with any one of those, but you bring all of those together and you've got an effective strategy. And so we basically are operating under that modality. We also are of the view that all schools and all universities can find a way in a highly structured, disciplined, technologically enhanced way to operate and to work. And how do we know that? Well, we've been doing that, for almost a year now. And we've been doing that with we've been measuring the learning outcomes. We've been measuring the learning outcomes of our high school students. We have, last point, we have 150,000 degree-seeking students. We have hundreds of thousands of learners from 150 countries also connected to us. And we have tens of thousands of high school students that we're working with. And what we're seeing is that all of their learning objectives are still being made attainable in the modality that we're operating. So we're very excited to be here with you, Mara, and be a part of this project, and Raj, to have a chance to be with you. So thank you.
Most common phrase in the COVID era, you're on mute. Thank you, Michael. And now over to you, Raj.
Great. Thank you, Mara. And thank you, Michael. Let me just say, Michael, I'm so amazed by your leadership at ASU. I think I just tried to add up a few of the efforts that reach in-person instruction for students and digital instruction and hybrid programs. And in just a few of them, they add up to almost 750,000 people that are getting a benefit educationally from being a part of the ASU community. And so your extraordinary leadership at scale is making such a big difference right now in our country. And I want to thank you for that. I also very much admire the ethic you have brought around, reimagining the future through your Global Futures Labs and other efforts, and then recruiting talent like Mara Aspinall and others that can come in and bring a really multifaceted approach to problem solving, because the challenges we face as a country, as a community, for the generation going through college right now are so beyond the capabilities of any one sector of the economy or any one discipline of training to really tackle. So kudos to ASU and to yourself and the extraordinary team you've built. And I want to thank Mara publicly and in particular for and Nate for the work that they've done this past year in helping America develop an approach to COVID-19 that is grounded in the understanding that a data-driven approach is the only way to tackle a pandemic globally or locally. And the most important data is who's positive, when are they infectious, and can you use that data to take them out of the chain of transmission. And it's something Mara has been advocating for all year. And Mara, thank you for the extraordinary efforts you've made to reshape American policy at the federal level, but also to seed excellence in and innovation in diagnostics and testing as part of the response throughout our country through your collaboration with the Rockefeller Foundation. I'll just say briefly, it's exciting to be with everybody. I at the end of the day, I think what COVID-19 has exposed in American society and globally is the deep inequities that have built up over 4 or 5 decades that have changed our nation as we know it. It used to be the case that if a single wage earner in an American household could basically support their family and provide for their children, and good, reasonably good public education would enable those kids to be able to climb the ladder of opportunity. And for a lot of reasons, that has changed dramatically. And today, most working families need 2 wage earners and are unable to be as hopeful about their children's future here in the United States. And we've seen the COVID-19 crisis exacerbate those inequities pretty dramatically. Many households that are at the upper range of American society from an income perspective have done extraordinarily well with the digital acceleration that has transpired this year and the biotechnology acceleration. But 60, 70% of America's families are deeply, deeply suffering. And so the Rockefeller Foundation really, from the beginning of this crisis, said, okay, this is first and foremost a public health crisis. We have to rethink how we're crafting a vision and bringing together people from science and industry, political leaders from the Republican and Democratic side of American politics, and regional leaders across our nation to come up with some consensus approaches to tackling COVID-19 more effectively. And that led to a big push on testing and diagnostics, informed deeply by the work at ASU, and in collaboration with industry leaders like Mara, who have a depth of understanding of both what exists, but also what's coming. And I think the results of all of that work are going to become apparent in the next 4 to 6 weeks. I mean, I think we are moving from a place where, America was doing 500, 600,000 tests a week. We're going to move to a place where, we're doing 100 million tests a week, and that's going to transform what's possible. I applaud some sports agencies and sports leagues for sort of showing the way, and certain leading universities like ASU for showing the way. But you frankly shouldn't have to have a big MBA contract to be able to get tested and for that to be ubiquitous and to be considered essential. And so, as we redefine essential in a new era in this country, I think we can admit that schools and universities are absolutely essential. And the report the Rockefeller Foundation launched today, in collaboration with education stakeholders across the country and informed by teachers unions and the like, calls for testing teachers and faculty and adults that are in an educational environment twice a week, and students once a week, and calls for the federal government to pay for that at a cost for this next semester of about $43 billion, and highlights many of our partners that have demonstrated and collected the data over the last 4 or 5 months to illustrate that this is safe for everyone involved. It is actually probably more safe for people to be in schools that are well managing COVID than it is to be out in the community. And frankly, highlighted some of the harms of a deep distance learning approach for much of America's K through 12 population. There are about 50 plus million kids in that population, and too many are now lost to follow-up and unlikely to graduate. Too many are suffering from abuse and unable to get access to a safe environment in their school where a teacher might identify that they need more protective services. Too many are, and particularly minority students, are just suffering deep, deep learning loss that we know they'll never be able to recover from. And while COVID-19 is devastating, we as America cannot let this crisis undermine an entire generation of America's young people. They are our future. ASU has shown what is possible. I think with Mara's support and with your team's involvement, we've crafted an approach that is both achievable and practical and pragmatic, and would allow most American kids to get back into school as early as February 1st. And if I sound urgent, it's because this is an emergency that, has a moral underpinning. It's just not okay to let America's kids down because politically we're debating stuff. We have to come together and solve problems. And in our best days, that's what we've done. And I think ASU and the whole team there has contributed to a solution that we think has every chance of transforming the felt experience of COVID-19 in this upcoming semester.
Thank you. Thank you, Raj, and thank you, Michael, for those really important comments and your leadership to get through this. And I'd like to ask the audience to please add your questions to Q&A. But if it's okay, I'm going to start with some questions to both of you. And, you know, the first one is actually quite sobering, as exciting, as important the work you're doing. One of the key things that we've seen, not just in our country, but around the world, is skepticism about science, skepticism about data, and in some communities about education in and of itself. You're both students and scholars of science and technology policy. You've talked about the importance of that. How do you deal with this growing skepticism of science, and how can we return to a place that science is respected and education is a core piece of what, you know, what so many more need to think about? And maybe I'll start with you, Michael, from the university's from your perspective.
Well, I mean, first, you're right. There is this skepticism. I think we've done a poor job as scientists and educators helping people to overcome their skepticism. Humans are normally skeptical. That's one of our reasons that we're still alive. Meaning there's a natural fear mechanism in humans to be very, very cautious as they move out. And so here we live in this unbelievably complicated world where a 30 micron viron particle of a ribonucleic acid can enter your body and begin altering your DNA configuration such that it can kill your body. That's a lot for someone to understand that doesn't have a bachelor's degree in biology. And so rather than put the onus on the skeptics, I'm going to put the onus on the teachers. I'm going to put the onus on us and say, we haven't done a good enough job at learning how to communicate to people to understand what's actually going on, so that then you get, you know, I think we have relatively good compliance here in Arizona. We've got a lot of people that are moving in the right direction. We have a lot of skeptics, though. And what I'd like to do is just shift it a little bit and say that we need to figure out how to speak in a way where everyone can understand what we're saying. And then also we have to then reach in and understand that we're inadequately educating people. They're not prepared for the level of complexities that we're presently facing. So we've got two dilemmas. In the more immediate moment, we just have to keep messaging that it's not about you, it's not about you, it's not about you. It's about all of us together. And really plead to people's belief in their families and in their communities and their community's success. So we've got to do that. But we have a deeper problem, which is that we have to start thinking of the people that don't understand these things as stupid. Stop thinking about them in a negative way and start thinking about how we're going to learn how to communicate in new ways.
That's great. Raj?
Well, I completely agree. Look, I think Michael's background is one that illustrates what we need to do. I mean, science has to benefit the practical lived experience of American families broadly, you know, and we have to communicate it in that manner so that there's an appreciation for how important it is as the driver of our economy, the underlying principles that create our innovation, and ultimately allow us to solve problems that people understand as problems. Now, I'm always an optimist, so I'm hopeful. I think when, you know, 6 months from now, or 8 months from now, whenever it is that we are back to normal in some sort of lived experience, people believe it'll be true that a combination of diagnostics and testing and vaccination made that possible, all of which is a representation of science transforming our lives. And so I think, you know, I think that example will, for this era, perhaps be the most powerful one that will help people appreciate and understand the value of science if we communicate it as such. I also think that, you know, I mentioned this Global Futures Lab. Why I'm so fascinated by it, because, you know, you could talk about agricultural carbon sequestration and the underlying science in a way that, you know, most people do. and it is therefore, you know, I love it. I was, you know, at the U.S. Department of Agriculture, and I was a chief scientist for a while, and I loved it. But most people didn't, you know, and most people sort of tune out. On the other hand, you can talk about it as creating a new, negative carbon economy as you do in that platform. And all of a sudden I could imagine a whole generation of young Americans saying, hey, we need a negative carbon economy to survive. I want to be part of the solution.
And we can make money at that. We can build a whole economy around a negative carbon economy.
Yeah, exactly. And now all of a sudden you've reframed a scientific concept as a solution to a crisis that has, hundreds of thousands of young people marching in the streets across the planet, worried about their future. So I think there are ways to do it. And I think there are examples at ASU, and Rockefeller has been, in this space for 107 years, that are very, very powerful and very meaningful. I'd say one other thing, which is, we as a country and as a society celebrate heroes. We do it all the time. And mostly, I'm a big basketball fan. I love watching LeBron James play basketball. But, the LeBron James of agricultural research was Dr. Norman Borlaug, actually Rockefeller Foundation's longest serving employee. He was 45 years as an employee of ours, and he won the Nobel Peace Prize, the Presidential Medal of Freedom, and the Congressional Medal of Honor, something only a handful of human beings have ever done. And he did it because of his scientific advances in agricultural productivity that sparked a green revolution and helped move hundreds of millions of people off the brink of starvation over a 20, 30-year period in the 60s, 70s, and 80s. And, those are the kinds of folks we should be celebrating as heroes more publicly. I'm glad that Dr. Fauci is getting a lot of attention now. I hope there are a whole generation of young people that say, hey, I kind of want to be like that guy who is, who's helping us solve the toughest challenge we're facing. So I think we need to learn a little bit from modern celebrity culture and create more citizen scientists that we can grow to admire. I'd say in a modest way, Mara, and I don't want to be too flattering here, but I think your willingness to take so much of your time this year and bring your kind of scientific and industry background to helping to craft an actual solution to testing and diagnostics for America. Maybe won't lead to public celebrity, but amongst those of us who see that contribution, like I wish we had thousands of people like that who had that level of skill and talent and training and then said, hey, I'm so committed to my country that I'm going to put that effort to work on practical solutions in the real world. And that bridging that is really very special and very important.
Well, thank you. I guess we call it now Generation C, all the kids who were born during COVID. And I am, you all take you want to be proud for your family and for your friends. So I get to tell my new grandson that he lived through this time. But a lot of so thank you both for that big picture. We have a lot of questions in the chat about how do we harness this energy? You both talked a lot about it, but I'm going to go a little bit more on the skeptical for a minute to challenge you a bit, because part of leadership is clear communications. Michael, you did that from the very beginning in January, that you were starting to talk about this pandemic that so few people had even acknowledged. But because it's science-based, we've had a lot of changes, that things that were told at the beginning were no longer true. And as we know, in a science-based environment, you get new data and you move that forward. That's great when you're in a lab with 12 people, but how do you continue to keep credibility, and not just on science in the pandemic, but as leaders, when the facts and true facts change, when the interpretation of the data changes? How do you keep your teams motivated and moving, where sometimes you've got to shift 2 degrees and sometimes you've got to shift 90 degrees, and keep your credibility and have everybody still comfortable with leadership going forward?
I mean, I think the approach that we're taking is to be as direct as possible, to constantly be talking about where we are, where we'd like to be. We've had thousands of our students have tested positive, both those that live with us and those that live near us. We have had fantastic testing and tracing and isolation, and that has worked. That has been an effective way to manage this. It is the case, as Raj suggested, the numbers of our students that have tested positive is far less than the general number of the same age group in the broader population. And so the key has been, and there's been a lot of, as things have shifted and different things have happened and lots of anxiety, I think justifiable anxiety, people have wanted us to be, reporting out every day. We decided not to do that. We decided to report out every few days on a disciplined kind of way to make as much of our information available, but then also to make our people available for dialogues and discussions, which is better than just a graph or a chart, which is subject to interpretation in 500 different ways. And so, Mara, the approach that we've been taking is hands-on, direct, constant communication, constantly engaged, and then disciplined articulation of analysis, very, very disciplined analysis, because there's so much going on that if you over-report, you're going to confuse everyone over and over and over. So that's kind of the approach that we've taken.
Raj, do you want to add anything to that?
Well, I endorse that entirely, and I would add one concept, and that is, informed risk-taking is actually kind of the threshold for leadership in a crisis. I ran the Haiti earthquake response when I started my role in the Obama administration, and I went on to lead a famine response in Somalia and the Horn of Africa, and then ultimately the West African Ebola response during that pandemic threat. And I'd say in all of those cases, and especially in the last one in Ebola in West Africa, retrospectively, the most important things we did were grounded in judgments that were at the time controversial or risky. So, for example, the mindset around how to tackle Ebola was getting people who were positive or likely to be positive into Ebola treatment units in total isolation, and that was it. And any kind of engagement to provide palliative care or to deal with the deceased in the communities they were in was seen as very risky. And because it might discourage people from going to ETUs, which was our nomenclature for Ebola treatment units. Well, it turns out people were, going into Ebola treatment units, never coming out, and communities felt like they couldn't trust. All they knew was if a member went in there, whether they were tested positive or not, they never came out. They died there, and the trust kind of dissipated. So we created WHO burial teams and fully masked and gloved groups that would go into communities, coach families, remove deceased bodies, communicate with local children who would hug and kiss the bodies of a deceased grandparent. And all of a sudden we saw that, that was 70% of transmission, and it plummeted quickly. But when we did it, there was it wasn't rock solid to know that it was quote unquote safe or quote unquote validated. It was a judgment based on data-driven insights. And I suspect when Michael, you set up the approach you just described at ASU, it's a judgment that, okay, if we test with this frequency, we're going to kind of maintain some safety. Or if we communicate at this frequency, that's going to be enough to get the threshold between transparency and fear management right. Or if we try this and we see that moral hazard changes behaviors and risks go up, we can adapt. All of those are risky judgments. And at times of crises, I find sometimes even the best scientists can be a bit paralyzed by wanting totally validated data, and the ability to take measured risks during a crisis, be conscientious of them, and then manage through them has, in my experience, made a lot of difference in crisis management. And I would just call that out.
Yeah, Raj, that's a fantastic articulation, because it is a calculation on our part, where we're attempting to manage anxiety and fear and transparency and communication and so forth and so on, because, the management of the virus has meant also lots of positives, and then trying to manage our way through that has been complicated. So I appreciate the logic that you just outlined.
So let me thank you both for those and sharing some of your personal experiences. I'm going to shift now to questions from the audience, and we'll go into lightning rounds because I'm going to try to get as many questions in as possible. But the first person to start with is the person who's been phenomenal in communication, Dean Deborah Hellitzer. In the College of Health Solutions, her Friday afternoon silver linings have, I actually get teary-eyed when I think about them, sharing personal and professional. So her question, women's professional development has been impacted more significantly than men. And I would say that's true at every level, because most of the caretaking of children who are now at distance learning has been left to them. How do we devote extra effort, focus to ameliorating this disparity and improving this, not just today, but for the future?
Well, I mean, the approach that we're taking, and I appreciate that question, Deborah, and it's absolutely right. And it's first recognizing that it's true and just operating under the assumption that it's true. And then from there, building in what we're calling maximum flexibility. You know, we're allowing staff and employees and students to travel at the speed of light via this technology that we're using right here at will. And so, you know, we're not requiring certain things that we may have required in the past. And so it's basically by empowering every person and every family to have as much flexibility as possible, while also protecting and securing their employment. You know, we haven't laid anyone off. We haven't had any salary reductions. We haven't, you know, we've worked very hard to maintain the continuity of the institution, while at the same time creating maximum flexibility in our employees. And I'm speaking narrowly now about our employees, about the broader society. Relative to the broader society, what we're trying to do is we're trying to deliver at the family level every asset imaginable to help the management of the family through the pandemic on particularly educational attainment. And we hope that those things are being used, and we hope that those things are being helpful. So that's two parts of our approach.
Raj, I know this has been critical to the K through 12 approach and inequities that you've been fighting.
Yeah, I agree with all of that. I think maybe the inequities in the crisis, and in particular in K through 12 education, have just not gotten the attention they deserve. We've been so focused on appropriately, you know, avoiding risk, that we have created some secondary consequences that in some cases are far higher than the risks themselves. And you know, we pulled together experts from around the country on K through 12 education and learned that, you know, child abuse in America is way up. Child deaths from abuse are way up. Schools have been a safe haven for kids, where teachers identify kids who are at risk and thankfully get them into some degree of protection. And that system is broken. We see child hunger is way up in America in 2020. Child hunger way up, because schools have been the linchpin of providing food to those who are vulnerable in terms of breakfast, lunch, and, you know, take-home packages for tens of millions of Americans, tens of millions. And so, and that's not even capturing the deep learning loss that's been really extraordinarily challenging. I think we underestimate learning loss in this country and what the consequence of it is. You know, American education has for decades been on a path to try to improve graduation rates. And I think we're about to see a big drop off, and particularly for lower income communities and minority communities. And, you know, you can't build a more accepting and a more connected and a more peaceful and a more productive society if you fail America's kids across the board. And so those I don't think have been adequately weighed against the risks of reopening schools under, you know, appropriate safety protocols. And I lament that hasn't happened, but I also feel like that's, you know, in the role I encumber, a chance to try to bring people together and reckon with who are we as a country and can we do better than this?
Yeah, thank you. Sobering, but well, both of you talked a lot about testing and the importance of diagnostics and getting that information to go forward. Christine Cassell asks, since it seems like we will start to have enough tests to make widespread and frequent population testing available, like ASU has done in Arizona, What will create the ability to distribute these new tests? What about a broad testing strategy? And do you think this should be dependent on federal, state, or local entities? And how can the data be tracked? ASU has its own system, but on this one, I'm going to start with you, Raj.
Sure. Well, I think it's all of the above, and all of the above with a much more legitimate federal guidance on how to think about prioritization as a society. So, for example, because we know that for the very near future, you'll still have a relative constraint on test availability. So, yes, CVS should be a place where testing is available and accessible, but also schools need to be a place where people can get tested. And collection can happen. And if it can't happen on every campus, then there needs to be some central distribution that enables that. Universities like ASU, University of Illinois, and American University are all doing things to both ramp up testing for their own population and then make that platform accessible for K through 12 educational communities in that area, in their catchment area, so to speak. That can be a solution that helps to ensure distribution happens. And frankly, without stronger federal guidance and federal reimbursement for asymptomatic screening testing in particular, we know what's going to happen. Distribution will skew towards those who are wealthier, those who have access to healthcare, those who trust their healthcare providers, and those whose companies provide it. If your company might be the NBA or it might be a local one, but either way, that's where the testing capacity goes if you don't have some national strategy, which is why we've issued 3 national strategies, why we work with now more than 50 local cities, Native American nations, as well as states to coordinate the testing distribution in America.
And Michael, you've worked so closely with Arizona. Give us your broad perspective and how you've done it so well in the state.
Well, first, let me say that one of the errors that we've made in all of this, the overall COVID thing, has been to think that somehow it was going to go away just around the corner when it's not. So this is the 7th coronavirus to enter the human ecosystem. The other 6 are alive and well, and this one will be alive and well for a long time. It will be managed by a range of things, including testing. And so what we've basically done is built the highest speed in terms of turnaround time, easiest to deliver, spit into a tube, test imaginable with now, I can just take my tube down to the parking lot attendant, hand it to her, and then it gets tested and I get my data back. And then by spring, we're going to have a microfluidic device. You just spit into the device wherever you are, a point of need device. And that's advanced technology that we've developed will then communicate to your cell phone in a few minutes, and it'll say that you're ready to roll, and you make this thing as close to free as possible. So testing needs to be ubiquitous. We're going to have to be testing for years and years into the future. We could end up in a better situation with this because we don't have that for the flu in the same way that we do for this. This is more contagious and more lethal. And so we're going to have to get into our notion that human beings are going to have to be tested for this coronavirus into the infinite future. Just figure it out at one level or another. There may be outbreaks in this community or that community or this school or that school. There may be something happening in some part of the world where the virus hadn't really been active, and now it is in other parts of the planet. And so we just have to understand that this is going to be it's like brushing your teeth. We need ubiquitous technologies that are easily deployable and available to everyone. And we have to figure this out right now because we've wasted too much time not getting this done.
Oh, so very true. And I think that it creates the challenge. When we've had other emergencies, there's an end to it, a war. You can celebrate. And I think acknowledging the fact this is going to go on for a while deals with psychologically the fact that there is not going to be one day where it's over. We're going to deal with it and improve our well-being along the way. But if we use that, I'll use that as a connection to the future. We have a question from George Basil, which is thinking about the next economy and developing sustainable enterprises for these thriving global futures. Where do you see high leverage opportunities? Where does either COVID require or enable us to be in new industries moving forward? And what are the specific opportunities that you think that we can catalyze transformational impact? Raj, you want to start with that one?
Sure. Well, look, I think, if I step out of the health mindset for a moment and just think about the global economy, wealthier nations, nations with central banks and nations with the ability to manage their own monetary policy have effectively done somewhere between 20 and 30% of GDP as a stimulus to support recovery and crisis response from an economic perspective, right? And if you look at emerging markets, they've done 6%, and developing countries, about 70 of them together, have done 2%. And when you kind of overlay that with the reality that the vaccine will be distributed first and fastest in OECD countries, and then will likely take years to reach real distribution at scale in much of the emerging world, you end up with a natural pathway that is going to lead to a lot of divergence and inequity in terms of economic recovery. And you understand the reality that, frankly, the capital we're pouring into economies right now under the rubric of recovery or crisis response, it is a once in a generation opportunity to reshape our economies, right? Because you're not going to spend trillions now and then do it again next year, because climate is a crisis. So the reality is we got to make sure this recovery itself is fundamentally green, is fundamentally driving sustainability, is fundamentally tackling inequity. And we can do that in a lot of different ways, infrastructure investment that supports the greening of the economy. Globally, Rockefeller actually is supporting a $1 billion global green recovery by seeking to, create much more renewable energy as the basic developmental pathway for developing nations around the globe, and tackle what we call energy poverty. It's the billion people that live in extreme poverty because they don't have access, believe it or not, to kind of reliable, always there electricity. It's hard to believe if you're not exposed to that work, but it's true. And so we see that there's this unique moment of overlap, maybe for 18 months or 24 months or 36 months, but probably not much longer than that, when there's an overlap between putting real public investment into economies around the world and the need to make this energy transition, transportation transition, agriculture transition. We're big on agriculture and food systems because that is the biggest sink of carbon available to humanity. And it needs a fundamental rethink that probably is tethered to some sort of carbon pricing structure that can be viable. But the time and the moment is now. And if we miss it in this 3-year period, the chance we're going to have the resources to go big sometime in the future, just after that, feels unlikely to me. I lived through the Obama administration. I remember when we did the Recovery Act, the plan was always do recovery and then we'll do this and then we'll do that and then we'll do that. But the truth is you do one big thing and you're sort of tapped out politically and financially. And so I think acting boldly, acting now, and acting with the mindset of economic transformation is critical. And that is the leadership challenge of the next few years.
Yeah, I think what I would add to that, Mara, to George's question is that, I'm hopeful that COVID has gotten the attention of enough people to actually understand when someone says to them that the planet that we live on, with 8 billion people growing to possibly 10 billion people, can have a single zoonotic transfer of a virus into the human ecosystem. And lo and behold, within a few months, you've got negative outcomes across the economy of all of these billions of people. Do I have your attention now that we live in a completely interconnected world? If I don't, then you need to read these things and listen and catch up, because we really do. So what I'm hopeful of is that we can use this as a catalyst to do some of the stuff that Raj is talking about, to move away from our very limited early 20th century, mid 20th century model of economics, which isn't fast enough, isn't intergenerational enough, doesn't think about complexity in the way that it should. There's a market failure here. So the outbreak of this virus on a global scale is a market failure of a market incapable of responding quickly enough, if I'm using simple economic theory here, which means simple economic theory doesn't work. And so what we need new tools, new pricing, new valuations. Ecosystem services need to be valued. Carbon needs to be valued. We need whole new ways to think about things. Otherwise, we're going to have these kinds of disruptions at increasing scale, increasing negative impact. And I mean, COVID-like things, but it won't be COVID. It will be, if you read Kim Stanley Johnson's Ministry of the Future, a heat wave in northern India that kills, 20 million people in a week. And so things like this, massive events of complications, of complexity management. What we need, to George's question, is we need new tools, new systems, new understandings, new structures, new markets to be able to deal with the actual complexity that we're facing. So last point here, COVID-19 is an inability for us to manage complexity. We didn't respond quickly enough. We're not organized well enough. We don't have global institutions at the level that we need them to be able to operate. We weren't prepared, even though we knew this could happen, because the market said it really wouldn't make a difference. And so that's all wrong. All of those systems need to be updated and enhanced, and we need to get about that business. So my last point, do I have your attention now?
You do. And when you talk about these large institutions, we've talked about educational institutions from all different types. We've talked about governments, but there's a question from Pam Delargy, which is about business and workplaces and private industry. Some industries have posed more risk to workers than others, whether it be food processing. Some are regulated and some are not regulated. As we go forward, how do we get the private sector to engage? We did a report with Rockefeller on workplace commons, and we found that many have really been outside of this pandemic. They've said, go home and work and we'll figure it out later. How do you see the private sector getting more involved as we start to recover and go back to normal? Raj, you want to start with this one?
Sure. Look, I think you need, I really, this, Mara, I think you need some federal guidance, and you need the CDC in particular to offer some sort of guidance on, in specifically on asymptomatic screening, by industry, and to put that in the context of what's going on in a community, so that people can make decisions informed by public health guidance. What has been the failure of this response has been every school, every university, every retail enterprise, every meatpacking plant sort of figuring it out on their own by calling their friends. Sometimes every governor, by calling their friends or calling people who might know something, who might have access to testing, who might have heard about the vaccine's timing and what that means for how they do their planning. That's no way to run a public health response or a country. So I think you need to offer more tools to American business to be a part of that, and to do that in a much more structured and tiered manner. The benefit of that also is that does then protect those businesses from some degree of liability exposure. It's reasonable that people would be really nervous about making certain types of decisions when there's no national standard, there's no kind of governed judgment, and you're on your own, because then you feel like I'm owning and liable for a public health judgment that a meatpacking plant or a retail outlet is not independently structured to make.
And Michael, you've done company partnerships.
Yeah, well, so I'm going to take a slightly different approach, because I want to get this idea into the audience, and that is, I agree with what Raj is saying on the sort of practicalities of the managing our way through this virus. But I think the virus has also laid bare the unbelievable selfishness of most capitalists. And what I mean by that is, I'm not using selfish in a pejorative sense. I'm using it in a narrowing sense. And so, the rank order that we should all have in any business is human capital first, and the development and fair treatment of human capital, which has not gone on in what we're doing. Natural capital second, because we're reliant on our natural systems, to work with from the planet, and then financial capital third. And so there are some companies, like one of our partners, Starbucks, which is now releasing this whole notion of profit positive, people positive, planet positive, and they must make positive contributions to all three of those things. Now, if you think of this in the context of COVID, I think people hopefully understand that there's people who are, their lives are dependent upon people that are undervalued in our economy, who are, not being taken care of in the way that they should be taken care of. And I think what we need is a modernization in the private sector, in the business sector, in all sectors of these three things: people, planet, and profit, all coming together in a way in which we can make these things work. And we've just sort of exposed our weakness here. We haven't taken care of our people in the way that we should. We haven't taken care of our planet in the way that we have to, and we've focused too much attention on profit.
Wow. Well, the sobering piece of that is important for us all to recognize. But let me ask one very final question, and I'll ask you guys for quick answers with our 2 minutes left here. With the holidays coming up, I can't believe it's 9 days away from Christmas. A lot of people are really looking forward to, if nothing else, sleeping late and having a day without Zooms, or at least only family Zooms. What advice do you give your teams and broader to get through the holidays and start again in January? Raj, and then I'll give Michael the last point to you.
Well, I've told our crew to just get time to be with family and community. It is, I don't know how everyone has made it through 2020. I think objectively it's been a lousy year. And for some, it's had some real silver linings, but as a society and as a global community, it's been a very, very challenging one. And so I think time with your village, whoever your village is, and time to kind of disconnect and recharge is what I've asked folks to really take to heart, and maybe this year more than others really commit themselves to that aspiration. And I'm also hopeful that if more of us do that more regularly, we sort of show up better after that, and you show up with better set of values, better set of ethics, a better set of tools to navigate a diverse and dynamic society. And we all need that right now as well.
I mean, it's hard to add to what Raj said, because those are really the things that we need to do. I mean, I think within the institution itself, I mean, what we're saying is, take this time to be close to those that you are close to, but carefully. Follow all of our guidelines. Remember why we're here, that we're an essential part of the success of our overall society, and come back as energized and as creative as one possibly can after the holidays. And let's just sort of keep at it. So we're just basically just keeping at it in every possible way. And I hear from people sometimes they're anxious about the future. Anxious about the future, yes, but we should also be positive about the future. We will work our way through this, and we will come out of this better, stronger, smarter, more capable, more thoughtful, hopefully more understanding, more caring about everyone in our society. And so I look at this as a very difficult moment that could produce some really great outcomes for everyone. So.
Well, thank you both, and a perfect way to end on a positive note. Let me just say thank you both for caring, individually caring, and caring for your teams and giving them the information, the motivation, and the ability to make a difference in so many people's lives, not just in one state or one country, but truly making that impact around the world and giving people hope that we will get through this, and one way or another, we will be stronger and smarter. So thank you both for your leadership.
Thank you, Mara. Thank you, Nate. Nice to see you, Raj.
Thank you, Mara, and thank you, Michael. Good to see you.
All right, bye-bye.
So as we wrap up, that's all we have time for today. Thank you for attending, and we hope you enjoyed the conversation and took away some new ideas or knowledge. We value your feedback and plan to send a brief survey asking for your input about today's webinar, and we greatly appreciate your participation. We encourage you to visit asucovidcommons.com to learn about future webinars, read our new report, Facing Uncertainty, the Challenges of COVID-19 in the Workplace, and get the most current data on COVID tests at testingcommons.com. That's also where you'll find today's recording, and please Save the date for the next webinar in the series, which is planned for Thursday, January 14th, 2021 at 9 a.m. Mountain Standard Time. Thank you all for joining.